Ever heard of orbital myositis? No? Well, you are about to dive into an intriguing world of this rare medical condition. Picture this: the muscles around your eye, the ones that let you blink, squint, and look around, suddenly become inflamed. That's the reality for people with orbital myositis, a condition that's not widely known, yet can significantly impact those who suffer from it. Imagine your eyes as the earth, and the muscles around them as the atmosphere, protecting and facilitating every glance, every blink. But what happens when this protective shield gets inflamed? That's orbital myositis for you, a condition that inflames the muscles around the eye, causing discomfort and often pain. While it might not be a common dinner table conversation, orbital myositis is a condition that deserves our attention as it affects the quality of life of those who suffer from it. Now that we've uncovered what orbital myositis is, how about we delve into its causes? You may be wondering, what causes this rare condition? Let's get into that. Orbital myositis, an inflammation of the eye muscles, often leaves us scratching our heads. Why? Because the exact cause is frequently unknown. It's a medical enigma, a puzzle waiting to be solved. However, we do have some clues that lead us to potential culprits. Our bodies are complex and sometimes they can turn against us. Orbital myositis can be associated with systemic diseases, conditions that affect the body as a whole. In these cases, the immune system mistakenly attacks the body's own tissues, causing inflammation. Examples of such diseases include lupus, rheumatoid arthritis, and scleroderma. Next on the suspect list are infections. Think of bacteria, viruses, or fungi that have decided to take up residence in your body, causing havoc. These unwelcome visitors can trigger an inflammatory response, which may lead to orbital myositis. Lastly, let's talk about medications. There are instances where orbital myositis can be a reaction to a certain medication. It's a rare side effect, but it can happen. The body may react adversely to a drug, leading to inflammation of the eye muscles. So, while the exact cause of orbital myositis often remains a mystery, these are the usual suspects: systemic diseases, infections, and certain medications. But remember, every case is unique and may not fit neatly into these categories. Interesting, isn't it? But how would one know if they have orbital myositis? Let's explore the symptoms next. So, how can someone recognize orbital myositis? It's all about the symptoms. Orbital myositis, this inflammatory condition of the eye muscles, can reveal itself in a variety of ways. The most common symptoms people experience are eye pain and swelling. This isn't your typical "I stayed up too late" kind of eye discomfort. It's a deep, aching pain that can worsen with movement, making it quite distinctive. The inflammation can also cause noticeable swelling and redness, giving the eye a bulging appearance. This isn't just about aesthetics. This swelling can make it difficult for the eye to move properly, leading to another symptom: double vision, or even vision loss. Imagine seeing two of everything, or struggling to see at all. It's disorienting, to say the least. However, it's important to remember that symptoms of orbital myositis can vary in severity. Some people may experience mild discomfort, while others may have severe pain and vision changes. The symptoms may also come and go, adding to the complexity of this condition. It's not a one-size-fits-all situation. The variability of symptoms is one reason why orbital myositis often requires a thorough evaluation by a healthcare professional for an accurate diagnosis. Symptoms give us clues, but it's the treatment that provides relief. Ready to explore the treatments? For those suffering from orbital myositis, what options do they have? Time to explore the treatments. Orbital myositis is not a condition to be taken lightly, but fortunately we have a range of treatments to combat this inflammation of the eye muscles. These treatments are varied, adaptable, and designed to manage the symptoms while also addressing the underlying cause. Firstly, let's talk about medications. Corticosteroids are often the first line of treatment. These powerful drugs work by reducing inflammation, easing the swelling and discomfort that comes with orbital myositis. Prednisone is one such corticosteroid that's commonly prescribed. It's important to note, though, that while these drugs can be highly effective, they do come with potential side effects, including weight gain, mood changes, and in some instances, osteoporosis. It's a balancing act between benefit and risk, one that your healthcare provider will help navigate. Now, if the condition is resistant to steroids, or if steroids are not suitable for some reason, other medications like immunosuppressants may be considered. These drugs, like methotrexate or azathioprine, can help control the immune system and reduce inflammation. Let's shift gears and talk about physical therapies. In some cases, patients may find relief through specific exercises designed to strengthen the eye muscles. This isn't a standalone treatment but can be a helpful complement to medication. And in severe cases, when other treatments have not proven effective, surgery may be an option. This could involve a procedure to relieve pressure on the eye muscles, or even an operation to remove the inflamed tissue. Again, this is not a first resort, but it's comforting to know that such options exist if needed. Remember, treatment is always individualized. What works for one person may not work for another. Your healthcare provider will consider the severity of your symptoms, your overall health, and your personal preferences when determining the best course of action. And that covers the treatment, but what's the takeaway here? Let's wrap things up. So, why is it crucial to understand orbital myositis? Well, imagine navigating through life with unexplained eye discomfort, swelling, or even vision loss. This is the reality for those living with the condition. Orbital myositis is more than just a medical term. It's a significant life challenge for affected individuals. Understanding it is not just about expanding our medical knowledge, but also about empathizing with those dealing with it. Early detection is vital. The sooner we identify the condition, the better we can manage it. The right treatment can alleviate pain, reduce inflammation, and most importantly, preserve vision, the most precious of our senses. Comprehending orbital myositis also underscores the interconnectedness of our body systems. It reminds us of the importance of holistic health, of not taking any part of our bodies for granted, and of the need for continuous learning and vigilance in healthcare. Remember, knowledge is power, and understanding conditions like orbital myositis can make a world of difference. Stay curious, stay informed.